We do have a quorum.
Thank you, everybody, and welcome back. So I'm calling this meeting to order for the EMCC, and let's start with introductions. And Kimberly?
So if we could we'll go down through roll call.
Oh,
Members.
sorry.
That's okay.
Let's go ahead and do
All
roll
right.
call first.
Yeah. So Will Hiller.
Present.
Thank you. Tina Nieto.
Here.
Sam Klemick. Jim Lineborg.
Here.
Harry Robbins.
Here.
Jody Schaefer.
Here.
Luz Garcia. Paul Wood.
Here.
There you go. I see Luz. Thank you. Paul Wood. Nick Greenson.
Present.
Greta Steinbrunner. Carla Spencer. John Anthony. Okay. Teresa Rios is here as ex officio. Gary Mollet. And Leanne Magoski, that we know is out of town. Michael Esslinger.
Present.
Roger Reinhardt. There you are. Cheryl Getz.
I'm on, Steve.
Ah, Roger, thank you. Gotcha. Ben Harvey. Noah Hawthorne. Joe Cafaro.
Here.
Keith Boyd. Andy Smith. I have the EMS agency staff. If staff would like to introduce themselves.
Kimberly Hernandez, EMS agency.
Deborah Hopgood, EMS agency.
Dr. Burley, EMS agency medical director.
Steve Brooks, EMS agency staff. And we see Susan Blitch, who'll be
Hi.
presenting.
Susan Blitch from County Council.
All right. Any guests who would like to introduce themselves and be part of the attendance record?
Ryan Alexander, Salinas Fire.
Michelle Kalinsky, Chomp.
Dave Craddock, Monterey County Regional Fire.
I also see Jeff Horner with his hand up.
Ah, wonderful. Thank you.
Morning, Jeff Porter with Kelsar Ridge.
Sorry, I got two names.
Sorry, Steve. Jeff Horner, Program Director with Kelsar.
Got it. Thank you.
Craig Erickson with the Pulse Point Foundation.
Thank you.
Then there's Ben Hitchcock from AMR and Silas Fitcher from Monterey Fire in the chat.
I'm here.
Monterey Fire.
So who was that?
Galvin's Panholzer, Monterey Fire.
Thank you.
And then Sandra Flores has her hands up, Steve.
Thank you. Anyone else would like to be placed into the record? Excellent. Well, thank you very much. Any members?
Steve,
today?
Angie Lopez put her hand up.
I'm sorry, who was that?
Angie Lopez.
Okay. Thank you.
Sam Ballesteri.
Got it. Excellent. Thank you. Any members that I missed? Excellent. Thank you very much.
All right, before we get started, I just would like to take a moment for a moment of silence for Officer JD Alvarado, who was shot and murdered on February 25th. I just want to say that my hearts and my prayers go out to his family and friends, and especially to Selena's first responders and those who were there that evening. As a reminder, his public memorial is tomorrow at 10 o'clock at the Robobank Coliseum. And we're there to honor a hero who gave the ultimate sacrifice to our community to keep us safe. So if we could take a moment, please. Thank you, everybody. Moving on, this is the time for public comment. Is there anybody in the public that would like to make a comment not to exceed 3 minutes on any issue that's not on the committee's agenda? See no hands and nothing in the chat. We'll move on to the approval of the past EMCC meeting minutes. It should be attached, the January 12th, 2022 minutes and the February 9th, 2022 minutes. Could I get a motion to approve both sets of minutes? Harry has moved. Can I get a second?
A second.
Jim Langford seconded the motion. Could I get a roll call, Steve?
Of course. Okay. Roll call. Will Hiller.
Aye.
Tina Nieto.
Aye.
Sam Klemick.
Aye.
Jim Langborg.
Aye.
Harry Robbins.
Aye.
Jody Schaefer. Thank you. Luz Garcia.
Aye.
Very good. Paul Wood.
Aye.
Nick Greenson.
Aye.
Okay. Those are the members I have here. I'll approve.
Thank you. At the beginning of this meeting, before you guys came in, they asked that Susan Blitch's report be moved up to this spot because we pay her by the hour, apparently. So Susan, will turn the floor over to you.
But at such a cheap rate. So let me see if I can share my screen. Can you all see that? Good. So I was requested to give an update on AB 389, which is relatively new legislation. This should be real quick because it's not very lengthy legislation, but essentially, and I gotta move so I can read it. It requires a county, or first of all, let me back up. It amends the health and safety code to add 2 specific sections. And one of the primary sections is, sorry, somebody's interrupting me. Go away. All right. Is that allows for a county who's contracting for emergency ambulance services to contract with a fire agency, which will provide those services in whole or through a written subcontract with a private ambulance service. Essentially, what that means is it allows for a model where instead of the EMS agency contracting directly with an ambulance provider, it would allow the EMS agency to contract with the fire agency to either provide the ambulances or with the fire agency who would subcontract with an ambulance provider to provide the ambulance service. It also requires after January 1st of this year that the county cannot enter or renew a contract for ambulance services unless it adopts a policy by either resolution or ordinance, which considers the inclusion of a number of items in the RFP. Those things include employment retention, demonstrating serving similar populations in geographic areas. In other words, enough experience. Looking at diversity and equity efforts, maintaining financial requirements, proof of insurance, that kind of thing, and that the ambulance provider would serve the public through community involvement, that type of things. It also, which is a little more interesting, says that the contract shall demonstrate how the county will provide for the payment of comparable wages. And frankly, you know, as everybody has seen the ambulance rates go up, one of the primary reasons has been wage increases so that Monterey County paramedics and EMTs can make similar to what other jurisdictions are making in the area. Frankly, market has kind of taken care of that. EMTs and paramedics are in short supply and they have to be paid at a comparable rate for us to even get paramedics in the region. Nonetheless, the legislature has wanted counties to demonstrate that through an ambulance contract that we're looking at comparable wages and benefits to employees. The next part is 231, which deals with a fire agency if the fire agency is subcontracting for ambulance services or bidding for being the provider of ambulance services. And mainly this section deals with ensuring that there is a fair, competitive bidding process. So it requires safeguards to be in place that would prevent an entity from participating in who gets the RFP award. It would prevent the entity who's bidding from participating in the development of an RFP for ambulance services. Some of you that have been around for a long time know that I've already spoken to these issues during the last RFP, but it's basically codifying conflict of interest codes which prevent somebody who has a financial interest in participating in the decision on a bid. That is kind of it. It's pretty simple. I'm happy to answer any questions. I think this came up because there was a question on whether the county was going to update their ordinance on the competitive process for ambulance. And pursuant to the law, we would have a choice of either passing a resolution with a policy that includes the categories required under the code, or we could change the ordinance. I can't speak to which one we would do there is an RFP coming down the pike, but not in the next few months that I'm aware of. So happy to answer any questions.
Susan, one question, and it's a definition of the term agency. An agency to me would be XYZ Fire or ABC Regional Fire or something of that nature. What is the definition of agency?
That's correct. And I can give you the actual, and I have to take off my glasses because I'm old. Means a fire protection district, including a fire protection district that is governed by the county's Board of Supervisors. We don't have that here. A joint powers agency created for the provision of fire protection services, a city, a special district that provides fire protection services, or a local agency authorized by statute to provide fire protection services. So essentially, every fire agency that provides fire services within the county would qualify.
Thank you.
Sure. Any other questions? Really fascinating stuff, I know.
Susan, I don't see any hands or anything in the chat, so thank you.
All right, that was easy. Thank you all. And I will get off and bill somebody else now. Take care all.
All right. And Steve, you said there was 2 presentations. Who was the second one?
That is correct.
I'll go ahead and take that. That's for Pulse Point. Thank you. So the EMS agency has been looking at options for a public access AED registry and how to get the community more involved in registering the AEDs here in Monterey County. We met with the folks at Pulse Point and they went over what their system offers. And I'd like to introduce Craig Erickson, who is here from Pulse Point today to do a short presentation on the Pulse Point AED registry. So I'll go ahead and turn it over to Craig.
All right, thank you. Can everybody hear me okay? Got a nod. That's good. I'll try to be as brief as I can, but basically Pulse Point's a nonprofit foundation. So I wanted to give you a brief introduction to our organization and then just show you the tools that we have that we partner with public safety to bring forward a AED registry with really the ultimate goal of getting those devices located in that critical first few minutes of a cardiac arrest. We'll also kind of talk a little bit about how it could integrate into the dispatch call taking process as well, again, to give visibility to those devices. So our foundation based in Pleasanton, we have 2 different applications and we've been doing this for about 11 years now. So if you go to the app stores, whether it's Google or Apple, you'll see, if you search for Pulse Point, you'll see a yellow app icon, which is the Pulse Point AED registry. And that's really what we're going to talk about today. And we also have a Pulse Point Respond app that connects into dispatch that really triggers alerts for a nearby cardiac arrest. So I wanted to differentiate those 2 things. Pulse Point Respond does have a cost with it. It's like a monthly subscription price because there is a lot of work to integrate with CAD and support that infrastructure. Pulse Point AED, however, is completely no cost. Our foundation provides that as part of our mission. And also it's sort of substantiated by some of the fees we do collect from our other system. So ultimately, with these 2 approaches, our goal is to facilitate early CPR and early AED utilization. As you guys all know, those are critical factors into cardiac survival. So just briefly, the full Pulse Point response system on how this works, and we are serving about, I think, 80% or so of the California population and in about 4,200 communities in North America. But with this system, if you're an app user, and maybe some of you have it on your phone, and if you're in a Pulse Point connected community, you could get an alert on your phone that sounds kind of like this. Not sure if you can hear that or not, but basically if you're within about a quarter mile of a cardiac arrest victim, if that victim's in a public location, you may get an alert, kind of like a proximity-based Amber Alert, says CPR needed. If you click that you're going to respond, it will show you your location, in blue, the location of the victim. In this case, it's on a golf course. And also then it will show you any nearby AEDs. And that's why the AED registry is a big piece of our full system. Because if you click on that AED, you'll see a lot of descriptive information about where it's located. In this case, it's in the Welcome Center Rotunda building under the time card station. So a lot more than just like a CAD premise note or that it's at the Palmetto Dunes Golf Course. It tries to really specify where that location is, and that's where the community involvement and kind of the involvement of the delivery partners with Fire EMS can really help build a quality registry. The full system also has some CPR how-to instructions, AED how-to instructions, and such, but I just wanted to give you a brief introduction to that. So ultimately, our foundation exists to try to, again, facilitate early CPR, early AED use. Bystander CPR can make a big difference, but early defibrillation can make a bigger difference. And that's, again, kind of the goal of the registry as we see it. So the PulsePoint AED registry is a hosted app. There's nothing to install locally. It's a real-time registry. So as soon as an AED is entered into it, it's immediately accessible to dispatchers, to the public, once it's approved. So again, nothing to install, it's real time. The goal is, again, to get these things out of the cabinet and utilized more than they are. I think nationally, AEDs are used by the public, well less than 10% of the time, typically because nobody knows where they're at. So our approach has a big community partnership aspect to it, which I'll talk about. Business owner, if they buy an AED, they can register it right within the app. Goes directly there. You don't have to re-enter anything in. It gives you an option for a review process, so you can validate any AED that's going into your registry before it's approved and before it shows up on maps and in integrations and such. We've also designed a lot of marketing materials, kind of the, if you see an AED, help, get visibility to it, register it, or they can go to the app and see if it's already been registered and verify that location. So there's 3 different tools that you'll have with the PulsePoint registry for your county. You would have the app. You'd have a form that you could embed on your website called aed.new. So if you just go into a browser, aed.new, you'll be able to enter in a new AED. And this is kind of where like business owners and such would report their AEDs to the registry. Then there's also a backend component called the PulsePoint AED administration portal that you'll be able to approve AEDs, verify them. If you're taking it to the level of adding in like battery dates, consumable dates, the system can send reminders for those items automatically as well. So I'm just going to go through the app really briefly here, and I encourage you to download it somewhere in your vicinity. If you have an AED present, just open up the app. It'll show you if it's already been put into the registry, which there's actually quite a few in Monterey County. I think there's 400 or so that have just naturally been added. But what it does is it will predict your location. So instead of typing in Diablo Vista Middle School, if you just type in the first 3 letters, it'll show you the whole business name. So that way for the user, it's quicker. You get, no misspellings. You don't get things in all caps. It also brings in all the address information and other attributes about that location, like hours of operation. And that's all data that can go into the logic in recommending if that AED is available. You can, put the pin directly on the part of the business where the AED is located, take a picture of it. Again, you could have, if there's other resources located in that cabinet, those can be identified. And then even if you're taking it to the point of tracking asset IDs, like I know PG&E is entered in a lot of AEDs that they have ownership of, within their service area, and they have, asset IDs added to those, so they can track those. It also allows you, like if you see an AED in the registry and you go to that business and it's not there, or the business has moved, the community can kind of report those issues as well. And this is an example of something that could also be done with like code compliance officers, possibly doing like pre-planning or building inspection processes. If they had the AED app with them, they could, validate those locations right as part of that process. And I'm kind of blowing through this, but we could provide more training on this and kind of strategies on how communities help implement this as well. So again, ultimately, you'll have a really good detailed record that you can then approve and manage. So I'm going to now move to show you your registry for your area. So a while back, the Tyler Hart Institute actually uploaded about 400 and some AEDs that were located in Monterey County. So these are the ones that are already, basically in your registry. But most of those are going to be pending because we haven't worked with anybody in public safety yet, like yourselves, to really be in that role to verify, approve them. And then once they're approved, they would then show up on, again, different map views. They can show up on integrations with dispatch. But the approval process is very straightforward. So right now I have, out of these 490, there's 468 pending. So for instance, for this one here at 3-Star Lettuce and Gonzalez, I can click tie it to Google Places. So whoever entered this originally probably didn't use the app because they don't have the exact address information. And again, the nice benefit of this is you get really good quality data, and ultimately it would tie this this record out for this location to other Google Place attributes like hours of operation and those kinds of things. So again, the process is pretty straightforward. You can filter by, different place types. Like if you wanted to see all the AEDs that were in schools or places of worship or community centers, you'd be able to see a breakdown of all those as well. So you got a really good start because again, that work with the Tyler Institute that they did on, basically taking their spreadsheet to import those records. So now you have some, good data to basically verify and approve. So again, I'm try to keep moving along for you here. And again, just to reiterate, there's no cost for any aspect of the AED registry piece. But our goal is to really help the dispatch center folks identify that AED right within their current tools. So if you're using like a Radius Plus for call taking, or a ProQA or a Power Phone for EMD, we have integrations established that right within that tool, you'd be able to go from, if there's an AED nearby, have somebody get it, to more informatively, there's an AED located at the store, send somebody to retrieve it from the customer service counter, and let me know when you have it back. So, really the goal is to get those devices, in motion out of the cabinets much more efficiently. So again, we can help you get integrations in place with the EMD software that you might be running. Again, there's no cost for that. And also with regards to call taking software like Radius Plus, we have an ESRI layer that would then integrate into that tool. So if you have a caller here with the blue dot, there's a layer that would show you any nearby AED as well. And if you click on that record, it's going to show you all that information directly from the registry, including an access code. So if it's a locked cabinet, like a 24/7 cabinet that might have a lock on it, if your centers have, those types of access codes, that can be right within the record as well, but it wouldn't necessarily show to the public. It would only show within that integration to like Radius Plus in this example. You can also send through a chat, you can send the AED location directly to the caller. So that way they have the map right on their phone versus a call taker trying to explain, okay, it's at the Heron Creek Golf Club, it's in the fitness center. So, a little bit easier on the workflow and, really powerful to put that in their hands. And then kind of the last piece of it is the community engagement piece. As I mentioned, there's a lot of marketing materials from, social media, graphics to billboards. And this can be all embedded into your, your social media accounts, your websites, to register a new AD in San Diego, for example. They have an embedded form right to that entry form.
Craig, I'm so sorry to interrupt. We still see, does everyone still see the pulse point AED where it's like the back end? Because I think we're all still seeing a screen or two back.
Okay, let me get back to the PowerPoint here. Thank you for mentioning that.
There
How's
we
that?
go. There.
Okay.
Yep. Okay, thank you.
All right, so I wanted to show you a few things here. So, and I'll blow by these quickly, but with ProQA, there's an interface. So you'd be able to see those locations right within the protocols that would be potentially beneficial for CPR and AED use. And then also then with Radius Plus. So like if you have your collar location, the Esri map will show you any nearby AEDs. And if you click on those, then it would show you all that data from the registry, as well as any access code that might be, in one of those cabinets. So then, as I was mentioning about San Diego, on their website, they have a link right to the form. They also have a link to a map that would show, a live map of all the AEDs in San Diego County. They're doing quite a bit with marketing as far as, this is just an example of one of the kind of standard marketing materials we have that we'd be able to put your logos on for you. So, you really own the registry and can manage it and try to make it, make it your own. But basically all the infrastructure, all the tools to market it, they're basically all in place for you. We would just need to put your logos on those tools and you'd have a full set. We've even done billboards like in the Hampton Roads, Virginia area, again, to try to help raise awareness of, get the app, register AEDs and build a quality registry. The San Diego airport has this graphic on it. So if you travel in and out of San Diego, again, there's more awareness building tools available here. So that's what I had. I wanted to try to be respectful of your time, but give you a good introduction. We have a dedicated AED registry trainer that would work with your teams to, provide an orientation, help you get strategies in place to manage and approve those devices. So any questions from your guys?
Chief Panelser for Monterey Fire. Does your list showed Monterey County EMS as being the entity that oversees the AEDs in Monterey County? Is it possible to have like sub entities so that we could have the city of Monterey's AEDs come through us, but they would also show up in the county's listing if it's approved and show up in everywhere where necessary to ensure that the access is available?
Yeah, absolutely. Kind of like a multi-jurisdictional, CAD. For the full system, we do the same kind of thing where some communities have it at the county level and some have it more broken out by jurisdiction or by agency. So yeah, we can set it up that way. Absolutely. The other thing you could do is you could have just a Monterey County AED registry and then have certain trusted users that have admin rights. That's another really good way to structure it. But yeah, our AED registry person would help, get it configured on whatever works best for your, your area.
Craig, this is Carla Spencer from one of the hospitals. Do you have the hospitals also participate? Because, we have AEDs in a lot of neighboring places around the campus and even, into our clinics. So there would be opportunity as well to reach out to the hospitals and the clinics, because that would make your database even richer, I believe.
Yeah, absolutely. And there's kind of two different levels of the PulsePoint AED app user. There's an admin level that would actually be able to approve AEDs right within the app. So like, kind of the trusted people in your county or in your community. That way it doesn't have to go through that portal where it's pending and then somebody has to go in and approve it. So it can really quicken the workflow on that. But that'd be a good example of like a trusted admin level user that you guys could set up and manage, however many of those you'd like to. Any other questions?
I don't see any hand raised or anything in the chat. Thank you, Craig, for that information. And to contact you, can you put that into the chat?
Yes, absolutely. I'll send you my email here in the chat window. I know that Kimberly and Steve have my contact info, and probably a lot of you do, but I'll send that over. And then again, it's already kind of structured and built initially. So if you want to continue that process, I don't know, Kimberly or Steve, if you wanted to, just reach out and let us know, we'd have our AED registry person, really begin to start working with you more granularly to get it in place.
Thank you, Craig.
You bet. And if you ever have any questions about the full pulse point system, I'm your person on that. I'm happy to discuss that with you at a later date if you'd like.
Okay, thank you very much.
All right. Thanks, everybody.
Thank you. Okay, going back to the agenda, let's move to reports. And the first one is the MAC. Deborah?
Good morning, everyone. Recently, a significant portion of our EMS agency time has been devoted to the 2022 policy and protocol cycle, including the review and revisions of policy and protocols, developing training tool, and then communicating with our EMS providers, agencies, and our other stakeholders. So in addition to all the effort that has gone into that, we also held meetings of all 4 of our QI committees in February. So the stroke and STEMI committees discussed system functions and concerns. They also reviewed recent cases. Our TQIC committee had a presentation from Dr. Hahn, one of the neurosurgeons at Natividad Medical Center, who spoke to the group about patients on anticoagulants and antiplatelet therapy who had sustained head trauma. That was in regards to a request to look at our trauma triage criteria related to those patients. So as a result of that meeting, we decided that no changes are currently necessary to that criteria that's been established. We'll continue to keep an eye on those things, though. The CQI tag group reviewed a presentation put together by Dr. Burley related to base hospital physician training. He has put that together. We'll be presenting that later this month on March 29th. And that will also be videotaped and available on our website for any future physicians who may join our hospitals and wish to review that. So we also took a look at ketamine data as that went into place on January 1st. Very appropriate, for the most part, uses of ketamine and appropriate dosing and documentation from our field providers with that new policy and protocol in place. Another big thing that happened was that we were able to have the Board of Supervisors approve our agreement with the American Heart Association to implement a contract for us to access Get With The Guidelines. That will provide us with direct access to information on our stroke and STEMI patients. We will believe that this will decrease the impact and burden on the hospitals to provide that data through separate processes. So we're really looking forward to getting that in place. AHA is currently working with SVMH and CHOMP to complete some data sharing agreements that will give us access to that, and then we'll be completing training and moving forward with the access. We've also been working with ESO to modify our agreement to permit expansion of our health data exchange access. That will let us spread that to other facilities within Monterey County. So once that agreement is in place, we'll be able to get those facilities in line to implement the health data exchange with EMS through those. Otherwise, there is the written report in your agenda packet. It has the registration information for Dr. Burley's training class and also our upcoming QI committee I don't know why I can't say that today. QI committee meeting dates. So I'm happy to answer any questions if there are any.
Deborah, I don't see any hands or anything in the chat. Thank you very much. Moving on to the operations subcommittee. Steve, is there anybody for that report?
Yeah, that was just a note that the minutes for the ops committee are in the packet. And if there's any questions about the minutes, we could try to answer that. Otherwise, it's just really a report.
Thank you. Moving on then to EMS agencies, Teresa.
Thank you so much. The agenda packet includes a staff report with some of the activities of the EMS agency, some of our accomplishments. Just to highlight some of them, I'd like to highlight the 2022 policy and protocol development cycle. We are almost, we are in the ending stage of that cycle, and we continue to improve our process. We're committed to doing that earlier, and stakeholders have provided positive feedback on the changes that we have made. At each step of the way, we have checked with them and taken the input to incorporate into the improvement of the process. Excuse me. Steve gave a detailed presentation at MAC on all of the input opportunities that stakeholders had in the 2022 cycle. At this point, continuing to our commitment to improve, we want to extend that timeline. That was one of the feedback that we received. And so internally, we are starting earlier in the review of the policies that are up for review in the 2023 cycle. We took all the policies and we've tried to divide them equally in 3 parts so that we can review all of them in 3 years. And so we will have about 51, 52 policies each year to review. On the good side, not all of them require updates. A good number is just a review to make sure that everything's okay. There's also a good number that usually require just minor tweaks, so that substantial changes are minimized. But since we're starting now, we have a kickoff meeting internally tomorrow. We are gaining a good 4 or 5 months into the timeline. And so our hope is to be able to extend the time for the public comment period. That has been one of the pieces of information that keeps coming back to us from the stakeholders, that more time is needed for the review of the policies to be able to provide a comment. We all of the input opportunities that we were able to implement in 2022, we will continue in 2023. We'll fine tune that. I think the team has done a great job as we go through this cycle. One of the things that we would like to take a look at is even our format for the policies and protocols. Is that the format that meets the needs of the system? So we will be reaching out to see, maybe present some options and see how the system feels about entertaining a different format for policies and protocols. We're also doing a better job at working with the mobile app developer to make sure that the policies and protocols are uploaded into the mobile app on time. The staff report also shows that we are working on a paramedic training program. It is still it's something that is moving fast. It came to us back in December, and so the goal of it is to have a functioning paramedic program. We all know that there's a shortage of paramedics everywhere, and hopefully having a paramedic training program locally that will help us to increase the number of paramedics in our system. You just saw the presentation on the public access Aed tracking, and so we will be in contact with agencies to see how we can move this forward. I think it is a good program. We have a responsibility of tracking the use of the AEDs. I think that's pretty much how this came about. And in our effort to be more efficient. We were exploring a different way of tracking the AED usage and the devices and their use, so that we're not, we're trying to move away from using just a spreadsheet or just copies of documents that get saved in folders. So more to come on that. And we reported before about the funding opportunity through the EMS authority. We applied to it. That was to reimburse, offset some of the cost of having trained personnel to vaccinate, to administer the COVID-19 vaccine. So the last couple of weeks when we last followed up, the funding has not been released, but as soon as it is, we will distribute it among the agencies that have participated. One thing that is not on the staff report is that we are looking at a revamp of how we do community education. In the ambulance contract, there's requirements for the ambulance provider to provide education of the community and involvement with the EMS community. You know, that language was written many months ago, 12 years ago. And so we are looking at taking advantage of social media and see how we can do a better job at educating the community. We will be bringing to contract compliance and eventually to Emcc a plan for educational campaigns for the rest of the year. The other thing that is not here on the report is that we are starting to prepare for May, which is the EMS week. We want to take advantage, just like we did last year. Our annual report will be due at that time, and to the board of supervisors. And our goal, my apologies, the gardener is here, and my dog is gonna start to go crazy. So last year we did a presentation. Dr. Burley and I did a presentation to the board of supervisors on the accomplishments of the EMS system. It was very well received by the board, and so we wanna do it again. I'm hoping that we can do it annually and take advantage of EMS week when we do the resolution, and also just give the update to the board. We will let everybody know, so anybody who wants to join the board meeting and listen to the presentation. It was the same presentation that we did for, I believe, if I remember correctly, we gave that presentation at Emcc, and then we gave it to the board of supervisors. I think it's a good opportunity to educate our county leaders and our EMS system, so they know all of the hard work that everybody does to make sure that we serve our communities. That is my report, and I'm happy to answer any questions you may have.
Thank you, Teresa. I don't see any hands, and there is nothing in the chat. Moving on to Mohawk, Deborah.
Yes, January and early February were quite busy for the Mohawk position. We had a large number of requests for PPEs, testing supplies in particular, and staffing assistance come in. Through mid-February, it's begun to taper off a little bit as the case rates and patient numbers throughout the county have decreased as well. So there is a written report included in the agenda packet. The COVID data update in there is as of February 28th. So we did have another set of data released on Monday, March 7th. So the current case rate for the county is at 11.4 per 100,000, which is a pretty significant improvement from even the February 28th data. Our test positivity is at 4.3%, also a big improvement. 20 patients hospitalized with 2 in the ICU and 1 on a ventilator as of yesterday. Those are all big improvements from that February or the late February data as well. Our vaccination rates have remained pretty stable. We're currently at 83% of the eligible population in Monterey County having received at least 1 dose, and then 75% who are fully vaccinated. On the vaccination front and testing front, in mid-January, we put in place the potential possibility for our local EMS agencies to expand their COVID vaccination practices to allow their EMTs to vaccinate pediatric patients. We had implemented something similar a little earlier for paramedics. We did, however, receive word from the EMS authority that as of June 30th, those low SOPs will be expiring. So we are currently in the process of evaluating our policies and procedures and seeing what changes we need to make to those to accommodate the EMS authority's announcement. And we'll be getting out a written communication to all of our stakeholders regarding those changes as we've got that drafted. As I mentioned earlier, we're continuing to work on supply requests and order fulfillment. We have had a small bit of testing supplies come in from the state. The county itself has also made a purchase of testing supplies. So if you or your organization is in need of any testing supplies, please put in a request through the Mohawk form. We do have some constraints on what we can provide based on allocations requirements put in place by the state, but we are trying to fulfill as many of those as we possibly can. The state also made an announcement that they are going to begin scaling back availability of PPE and other supplies. So we'll need to put more of an emphasis on working together locally and throughout our region to obtain any needed resources in the future as they scale back their inventories in their warehouses. The Mohawk's also been working on ordering for monoclonal antibodies and antiviral therapeutics. So we've been working on the distribution of those and then making sure that our local facilities and clinics are registered and eligible to receive those medications as their supply of those has increased. Finally, I would add that the EMS authority ended their data calls, their medical surge coordination calls that we were participating in. I want to thank everybody from the local hospitals and our transport providers who participated and provided data throughout that process. I know it was kind of a last minute request, but everybody was great about getting data to us and we really appreciate that. So that is the extent of my report. I'm happy to answer any questions.
Deborah, I don't see any hands up or anything in the chat, so thank you very much. Moving on to the EMS system performance metrics and the communication testing. Kimberly?
Okay, let me just start sharing my screen. Oh, sorry.
I am sorry. May I interrupt? I
Of course,
apologize for my
Teresa.
interruption, but I realized I tried to raise my hand, but I don't think it worked. I just want to make sure that I mentioned that the paramedic training program project, it is something that was brought to us by Chief Panholzer. I believe it is a grant that they secure for that program. So it is not something that we initiated. I just want to make sure that I say that I think that the way that I stated it gave us all the credit. But because we are the lead agency, we have to approve the program. So that's how we are working with all the parties involved in this project. So thank you for allowing me the opportunity to clarify that.
Thank you, Teresa. And your hand did go up. It got blended in with your Monterey County background, so with the logo. But thank you. All right. Any other comments or questions? Okay, I don't see anything, so we'll move on to Kimberly. Thank you.
Okay, thank you. Let me just share my screen. Hold on just a second. Okay, can you see my screen? Okay, so for the 800 megahertz system testing in December and January, CHOMP had a response compliance of 83% in December and 96% in January. So great job in January. And then for Me Memorial, they had a 97% response in December and 81% in January. Natividad, 7% response in December and 90% in January. And then SVMH had 86% response in December and 71% in January. And they had, I think I've mentioned it before, we're reporting these numbers to each hospital at the end of each month, so they don't see them just at the committee meetings. And so SVMH had expressed that they do still have a lot of traveling nurses and they're still working on making sure everyone knows to look out for the 800 megahertz and also the ReadyNet. AMR conducted the test 97% of the days in December, and they dropped a little bit in January. That was due to their move from CountyCom back to the Schillings Backup Center. So there were a couple days that they did not have access to their 800 megahertz radio. Any questions on 800 megahertz before I move to ReadyNet? Okay. For the ReadyNet MCI drills, in December, CHOMP had a response of 77% and 86% in January. Me Memorial had 100% response in December and 83% in January. Natividad had 97% in December response and 97% in January. SVMH had 93% response in December and 86% response in January. And then AMR conducted the test 97% of the days in December and 94% of the days in January. Any questions on either the ReadyNet or 800 megahertz? Okay, I'll stop my share.
Thank you, Kimberly. Moving on to the contract compliance working group. You again.
Okay, let me just share my screen again. And can you see my screen? Okay, thank you. Okay, so for response time compliance by priority, all priorities met or exceeded 90% compliance for the months of December and January, except for priority 1 in January, which was 87%. We'd like to note that staffing was extremely difficult for AMR in January due to the overwhelming number of staff that were out due to COVID. So response time compliance for green, all reportable priorities for the months of December and January met or exceeded 90% compliance, with the exception of priority 1 in January, which was 87%. For response time compliance yellow, priorities 2 and 3 exceeded 90% compliance for both December and January. Priority 1 in December was 83% and 86% in January. Priorities 4, 5, and 6 were not reportable for either month due to the 100 call rule. For response time compliance orange, in December, the only reportable priority was priority 2, which was at 100%. And in January, the only reportable priority was priority 1 at 86%. And EMS dispatch performance, this pretty much stays the same, pretty close every month. Dispatch performance was for December and January, continued to be well below the 59-second standard. For MPDS performance in December, 70% of the adjusted call volume was EMD'd and 4% of the calls were aborted due to help arrive. And in January, 73% of the adjusted call volume was EMD'd, which is the highest it has been since the new calculation went into effect. And 4% were aborted due to help arrived. And are there any questions?
Kimberly, there's nothing in the chat and no hand. Oh, Teresa has her hand raised physically. Teresa, that hand blends into your Monterey County logo.
I know, I'm gonna have to do something with that logo. I just wanted to say that, you know, we've been monitoring the changes to MPDS since we started looking at that big bucket of calls that end up in the MED category. And as we have done that, we've been able to improve the MPDS. So now that we've done that, I think it's time for us to go back and take a look at that big bucket of MED calls and see if there are any other that can be taken out of that bucket and reclassify differently. You can correct me in my terminology here. Just so that to minimize that big general category of MED calls, and hopefully that will lead to more calls being tracked through the MPDS process. Did I say that correctly, Kimberly?
Yes.
Thank you. You would have said it better.
You did great.
All right, any other questions or comments? I don't see that, so we'll move on to Roxanne. Thank you, Roxanne. And thank you, Kimberly.
No problem. Good morning, everyone. So I will be doing the overview of the other provider reports. So I'm just going to skip down to, we're going to start with Monterey. Why is this not working? Hold on. Okay, so starting with Monterey County Regional, this is the overall 90th percentile for all response areas. So the response times, the 90th percentile response times for all response area remains relatively stable. The average number of responses from January 2020 to February 2022 is 89 calls with 90th percentile around 15 minutes and 16 seconds. In January, there were 107 medically related calls with a 90th percentile of 14 minutes and 34 seconds. And in February, there were 79 calls with a 90th percentile of 15 minutes and 9.
Roxanne, I'm just
Yes.
getting a black screen. Is anybody else just getting a dark screen?
Yeah, it's not sharing. It's just giving the wheel of death.
Uh-oh. Okay. Let me stop sharing. and
We can
start
see it now. Oh,
something
we lost it again.
Oh. Okay. Okay. So let's see. Which screen did I? Are you seeing something on the screen now?
No.
No,
No.
just a lot of smiling faces.
Awesome.
And
why
your
did I
screen
say?
froze, Roxanne, like your frame on Zoom is frozen. So I don't know if something's happening.
Okay, so let me stop sharing again, and then sorry for the technical difficulties here. I Zoom disconnected.
Roxanne, I may be able to share this if you'd like me to.
Yeah, can you? Because I completely got disconnected from my visual.
Give me
So
a
I think
minute
my
to.
internet went out. Good thing I'm on the phone.
Yes.
So if you can, once you're in it, just so everyone can see slide 3. And then would you guys like to repeat that information so you can see what I'm talking about?
Give me a minute while this. Uh-oh, hang on.
Samuel Klimick has his hand up.
Someone's working on that version. Let me see if I.
Hi,
can-
Sam, go ahead and then we'll go to Nicholas. Sam, you're muted. No, we just see your lips moving. Nope, no sound.
Okay, I think we have. Roxanne? I think we
Hey,
have
Steve,
your
can you
report
hold
up.
on one
yeah.
second? Nicholas,
Sure.
you had your hand up. Did you have a comment?
Yeah, so I just had a quick question about, well, it's not a quick question actually, but I had a question about the change in the AMR contract regarding lake calls, the 1.5 system volume, and where's the appropriate place to discuss that and why it wasn't, something we were aware of before it came out in the contract.
I didn't hear the comment clearly, but I think if this committee wants to discuss, one of the things Dr. Greenson is that we have a contract compliance working group coming up. And so that's one of that will be one of the agenda, can be one of the agenda items that we have for that meeting. I think is very appropriate for the contract compliance. If this committee wants to discuss that, then it could be agendized.
Okay.
All right, did that answer, Nicholas, did that answer your question?
Somewhat. I still didn't hear why I mean, I'm on the contract compliance work group, and why that wasn't run through that committee before, it made into the contract. And I don't, and where that metric came from and how that was chosen and stuff like that. But yeah, if you want to add it to the contract compliance work group for the next meeting, I would appreciate it.
We will be happy to do that.
Sam, you had your hand up. Did you get your volume?
Can you hear me
working?
now?
Yeah, we can. We can.
Okay, sorry, I had a headphone problem. Again, I'm gonna flip my hair a little bit and claim new guy here, but the last few meetings that we've gone through this report and talking about numbers from 2020, I'm just maybe suggesting or asking the good of the order if it's something that we can either abbreviate to talk about maybe the closest quarter numbers relevant to the meeting date, or maybe abbreviate this report to where if we have questions with what's set out in advance, that we can just address questions rather than walking through all of these numbers every meeting.
So I can make sure that I have, which report or reports were you specifically addressing?
Just, when we're talking about the response times for the different agencies, I've got my report printed out here, and I've gone through it. So maybe if we review the report and have questions about it at the meeting, for the live meeting, just in the interest of time. And these reports, again, I'm looking at numbers going back to 2020, and I'm just thinking that we've discussed these, or at least since the meetings I've been sitting in, we've discussed these meetings in the context of going back a couple of years. So either maybe we abbreviate the report by just talking about the current quarter's numbers, or abbreviate it even further by, if we have questions based on what is sent out at the packet, that staff say will just answer those questions.
If I may, Chief Klimek, the pleasure of the committee in the past has been to see historical. And one of the reasons why you see that, particularly right now, it is because of COVID, so that we have a sort of a comparison. It came up also in contract compliance, where we were seeing certain numbers go up, and it was not clear if it was just, the numbers are skyrocketing or what. So by looking, in that case, we went all the way back to 2019. And by showing the data from 2019, 2020, and 2021, then we could see the numbers pre-COVID and during COVID, so that we could determine, are the numbers really skyrocketing, or are we getting back to a normal level pre-COVID? So that's sometimes why we present more data, and we try to respond to the needs. You're right that discussion, I think, we focus it on the current data, but sometimes it helps to put it in the right context. For example, the call volume. Call volume was one of the ones that raised questions, particularly with contract compliance, because we saw the numbers jump, but it was not clear. Are we going crazy now, or with calls, or what? But by adding the column for 2019 and then keeping the 2020, it gives us it puts things in the right context. But the EMS staff tries to respond to the needs of our committees. We try to provide as much information as possible to make sure that there's a lot of data that we're bringing to the table. We know that.
I understand that. I appreciate it, and that's why my only point to that is that it's a large report and a lengthy report, and we get it ahead of time. So all my ask is that if we have questions, perhaps we review our packets and we have questions, we can speak to the pertinent questions of the meeting. Because yes, the data is all there, and I appreciate that. I'm sure everyone appreciates that. But rather than have Roxanne go through it at length for every meeting, it's just a suggestion to move us along quicker. That's all.
We could include the report, and then the written report, and then maybe space out a verbal report for the committee. Instead of every meeting, we can do it every 6 months, or whatever the pleasure of the committee is.
I throw that out there for good of the order if anyone else has commentary on it, and I will mute again.
Chief, one of the perspectives from a historic, or one of the aspects here from a historic perspective, is we're looking at trends to kind of figure out what Teresa has said. Maybe the presentation can be tailored down, but one of our concerns for showing the historic data is to look at trends in a macro sense. That's where our performance is best indicated.
Again, I'm not questioning the content of the report at all.
Yeah,
Yeah,
right.
I'm just, as far as for the live presentation, all the data is here for us to look at, and if it generates questions, we can discuss that in the meeting and then go from there. That's my only point. Thank you.
Is that the preference of the rest of the members of the committee?
I think it's a reasonable request, but I think, just ensuring that you're given enough time to prepare it. I guess what I'm saying, trying to find that balance between not overloading the EMCC's workload, but also giving the board enough time to have access to the information. So I don't know if a minimum of receiving it by the Thursday prior to the meeting or something like that would be reasonable.
We would have to look at whether we can send the agendas earlier than that. We are following the Brown Act rules of when the agendas need to be sent out. Preparing the agenda package is a lot of work. Crunching the data is a lot of work. So I don't know just how much more in advance we can send the agenda package, to be very truthful with you.
Well, I know some of the boards that I've worked with in the past, we always made an option available to them that, so in particular with like budget items, where there can be a lot of questions, where if certain board members want information that others don't, that it doesn't necessarily have to be part of the packet, but it can be just presented to them, in an additional email. I don't know if that is allowed, but I think that could be an option, and that may save some time.
We have Brown Act rules. Steve, I think you're getting ready to say what I was going to say. Go for it.
Yeah, basically, the Brown Act would prohibit staff from taking anything to multiple members of the committee for their, if there's any potential discussion among them. You can pardon me, you can get almost any information that we have available, and we can provide that. We just have to be very, very careful that if it's a topic of discussion, that we don't in any way present it where it becomes discussed among the members outside of this committee. So
well,
there's that.
I think that's up to the board members to make sure that they comply with that. But I'm just basically what I'm talking about is just the release of public information. So I mean, in theory, that information could be requested by anybody in the county.
So Steve, getting back to Sam, I think all Sam was saying is that we get the report, it's included with the agenda, that covers Brown Act. When Roxanne makes her thing, she can say attaches the written report. Does anybody have any questions? Or if there's an anomaly or something, she can point that out in her report. She doesn't have to go over every number, and that complies with Brown Act.
Jody Schaefer has her hand up.
Yeah, I just wanted to support what Sam said. I would appreciate us following his recommendation.
Should we start with that now?
All right.
I can
Sorry,
summarize. There's no real, instabilities with the data. In short, so I'm not really sure where to go from here. Do I continue?
But is there a page that you would like to see, Roxanne?
I was on slide 3, Steve. Sorry, Teresa, you got cut off.
Yeah, I think what we are hearing is that a high level overview, if at all, the data is there, you have questions, you can ask the questions, and we can definitely do that.
Okay. Okay, so in slide 3 is where I was disconnected. Steve, can you actually skip to slide 4, the next slide? So with responses within fire's response area, again, everything remains stable. You'll notice that the response times were slightly lower in the same month in 2022 versus the prior year. And the call volumes were also similar between the 2 years, between 20 and 2021. Next slide. Okay, when looking at calls outside of the response area, it is important to, again, interpret these slides with caution because the call volumes are low. Just 1 or 2 calls can result in some statistical instability and fluctuations, which you see in the screen from month to month. The call volume in 2022 is not significantly higher than the same month in 2020 and 2021, but the 90th percentile response time is approximately 5 minutes lower than 2020 and just over 30 seconds lower than 2021. In February 2021, the call volume is exactly the same as February of 2020, but the 90th percentile is half the time as noted in 2020. And again, because the call volumes, this data should be interpreted with caution. And in February of 2021, with a 90th percentile, the time was 10 minutes lower than February 2022. In 2022, sorry, not then. Next slide. Now we're going to be switching over to Carmel, and the overall 90th percentile from January 2020 to February 2022 remains around 10 minutes, 10 and a half minutes. The call volume increased since January of 2020 as compared to the same months in 2020 and 2021. Again, around the same, nothing really to report here that's different. And then next slide, for responses outside of the fire response area, there was a bit of an uptick in January to almost 14 minutes at the 90th percentile. However, the 90th percentile in February was down to 10 minutes and 44 seconds, which is similar to the prior month. So similar to the overall picture, the number of responses have increased in 2022 as compared to the same months in 2020 and 2021. Next slide. For the most recent data for the 90th percentile within Carmel Fire's response area, there was an uptick again in February of 2022. This is notably higher as compared to the same months in 2020 and 2021, with just above the 4 minutes in 2021 and 8 minutes and 43 seconds. However, I would caution that all call volumes, again, low and then can lead to statistical instability. And that's it. Oh, no, sorry, one more slide. The final slide is for Carmel by the Sea. And then when we look at calls from, January 2021 all the way through, it's about the same, but it is lower at about 1 to 2 minutes as compared to 2020. And that is it. Does anyone have any questions, comments? Thank you, Steve, for doing the slideshow for me.
Roxanne, I apologize for throwing the blocks out in front of you there, messing up your groove.
It's okay. That's okay. It just, prompted us to keep it moving quicker.
All right, I don't see anything. And Teresa, nope, I don't see a hand in your Monterey County thing. So thank you. Thank you, Roxanne. Let's see. Moving now to old business. Susan already did her report. Moving on to new business, plus points done. So we'll move to Ben Hitchcock, the endorsement, and that's an action. So Steve, are there any comments?
Sure. So the appointment process for the subcommittees, MAC and EMS Ops, involves the appointment by the EMS agency director and then concurrence by this committee. So what we're asking for is a couple things. One, for you've seen the report with a little bio about both Ben Hitchcock and Will Nealand as being appointed to MAC, and also for Dave Craddock to represent fire protection districts at the EMS Operations Committee. So with the concurrence of this committee, the director will appoint Ben Hitchcock as representing the primary ambulance contractor to MAC, Will Nealand to represent field paramedics primarily on the fire department side, and Dave Craddock to represent fire protection districts at EMS Ops. So if there's any questions regarding this appointment, otherwise the EMS agency is seeking concurrence from this committee.
Is a motion appropriate, Steve?
The motion is appropriate.
I move approval of all three candidates.
Second,
I didn't catch a second.
Clemic.
Great, thank you.
All right, we have a motion on the floor to accept all three candidates, Ben Hitchcock, Dave Craddock, and Will Nealand. Can we do a roll call, Steve?
Yes, we can. I do have a question, and I'm sorry if I've was over aggressive and eager to get Will on the committee. Will Hiller, have you completed all your documentation post the Board of Supervisors appointment or to this committee? Because we need to have you complete a bit of paperwork so we can seat you on the committee. Have you completed that? Oop, I didn't catch you, Will. Not hearing anything from Will.
Sorry, I was on mute again. My apologies, everyone. Steve, I was not directed to complete any paperwork, but I could do that, no problem.
Okay, so at this point, then we'll have Mike as the alternate do the vote. So Tina Nieto,
Aye.
Sam Clemic,
Aye.
Jim Landborg,
Aye.
Harry Robbins,
Aye.
Jody Schaefer,
Aye.
Luz Garcia,
Aye.
Paul Wood,
Aye.
Nick Greenson,
Aye.
Carla Spencer,
Aye.
Mike Esslinger,
Aye.
and I think everybody else has the primary. Okay, thank you.
Thank you, everybody. Moving on now to the membership report, Steve.
Yes, in your packet, you will have received a report regarding EMCC membership, and that the members' terms expire every other year. This year we have 6 members, and of course their alternates all expiring. So the EMS agency will be reaching out to those members whose terms are expiring, see if they're interested, and also to the organization or body that may appoint them and seek reappointment from a request for reappointment from them, so that we can go to the board and keep the committee moving. Any questions about the requirements for EMCC membership or reappointment? Otherwise, it's just a notice, and we'll be reaching out.
Teresa has her hand up, Steve.
Thank you. I just want to really stress that the fact that we really need the help of the organizations who nominate their representatives to the committee to get those nominations to us. We have to take these nominations to the Board of Supervisors for approval. It takes us about 4 to 6 weeks to get items on the agenda for the Board of Supervisors. And then once appointed, as you know, you have to complete your oath of office. Members cannot be officially seated on the committee until their oath of office has been administered. And then there's other, some trainings and stuff, but we have time for that, like an ethics training and all of that. we start the process this early to ensure that all new appointments or reappointments can be done by June so that all members can be officially seated on the committee by the July meeting, which would be the beginning of the term for the committee members. So we really ask for those organizations who do the who nominate the representatives to help us in getting these things to the Board of Supervisors as early as possible, so that then we can work with both with the clerk of the board and the members in making sure that their oath of office and the other requirements are done before the July meeting. So thank you for that.
Yes. And
I think that we all, it's incumbent upon all of us to note that there's an involved administrative process here that EMS has little control over. It takes time to process this, and we need to get our nominations in early.
Yes.
Period.
And you know, again, at the bottom, if you will, of the report, we will see that Will Hiller has received appointment from the EMCC, and I will take responsibility for saying that I thought we had communicated with him regarding the oath of office and other things. We will be reaching out to get you seated on this committee in time for the next meeting.
So thank you so much, Steve.
Thank you, Steve. Moving on to the AB 361 and extending out the Zoom meetings. You want to go ahead and address that, Steve, as I.
Certainly. Okay, so for the AB 361, it's the same issue related to safety of meeting together, and then the ability to meet remotely under the AB 361 guidelines rather than under the significantly more restrictive guidelines of the Brown Act. So this committee is requested to have two findings. First, that the situation that allows for this is still in place, that there's a risk in this case for COVID, and it's best to meet remotely, and then that this body wishes to do so. And if so, the EMS agency staff recommends that this body meet in a special meeting on April 6th, 2022 at 9 in the morning. And therefore this body needs to have a motion and move forward with that.
So move, Steve.
Thank you.
Can I get a second?
I can second.
Mike Gessler and Paul Wood seconded at the same time, so.
I'm going to go with Mike. I saw his hand up moving forward. So thank you. All right, so Chief, roll call.
Aye.
Okay. Sam Clemick.
Aye.
Jim Lamborg.
Aye.
Harry Robbins.
Aye.
Jody Schaefer.
Aye.
Luz Garcia.
Aye.
Paul Wood.
Aye.
Nick Greenson.
Aye.
Carla Spencer.
Aye.
Mike Esslinger.
Aye.
Thank you.
So that motion passes. So we'll be having a quick meeting on April 6th at 0900. Please mark your calendars. Are there any announcements for the good of the order? One quick one that I announced in the earlier meeting, City Marina bought a True Narc machine that does the narco testing, so we can do it in the field. It will probably affect the peninsula more than any other area in the county. Are there any other announcements?
Sam has his hand up.
Who had their hand up? Oh, Sam Ballesteri?
Can you hear me now?
Yes,
No.
Sam, we can.
Oh, wow, I got this fixed. I just had a comment about the long response times that I've been listening to over the last couple months. Ambulances going from Prunedale to the peninsula, or dispatch from Marina to Gonzales. Those seem to be happening a lot more lately, and I just have a concern about that.
So noted, Sam. Is there a question in there or just the concern?
No, just the concern that they just did a new extension RFP, and a lot of people out in the field that I deal with still were concerned that they didn't add 1 or 2 ambulances to peak call volume periods. And I'm still fairly heavily involved. I'm on command staff for Monterey Fire CERT.
All right. Thank you. Thank you for those comments, Sam. Are there any other comments for the good of the order? Seeing none, our next meeting is May 11th. Our regular meeting's May 11th at 10:30. That'll be sent out. And again, we have the April 6th at 0900 to extend out to Zoom meetings. Steve, anything else before we adjourn?
No, I don't have anything else. Thank you all for participating. We appreciate your input very, very much.
All right, this meeting's adjourned. Thank you, everybody.
Thank you.
You.